Good afternoon, and welcome to the June 1st Community Update. My name is Stacy Wood, and I serve as a Public Information Officer here in the Emergency Operations Center. This community update is available in Spanish on the Buncombe County Health and Human Services Facebook page, and that can be found on Facebook at BCHHS. Today's updates come from Dr. Jennifer Mullendorfer, Interim Public Health Director and Medical Director, Dr. William Hathaway, Chief Medical Officer for Mission Health, and Fletcher Tove, Buncombe County Public Health Preparedness Director. We will get started with an update from Dr. Mullendorfer.
Today in North Carolina,
You have to mute your phone.
let's try that again. Today in North Carolina, our state is observing a day of mourning to acknowledge and grieve for the 100,000 people in America, almost 900 of these in our state, and at this time, a total of 29 in Buncombe County, who have lost their lives to COVID-19. This is an opportunity to be reminded that these deaths are not just a number. They represent people, families, and communities in mourning. People who have lost loved ones, and in many cases were unable to be with them in their final moments. Long-term care facilities and their staff are crucial parts of our community, helping to care for our siblings, friends, parents, grandparents, and extended family members. We value the staff and administrators of these facilities and respect their dedication and service. We recognize the dignity and humanity of those for whom they care. From the beginning of COVID in Buncombe County, we knew that outbreaks in long-term care facilities would likely become our reality. For the past several months, Buncombe County Public Health has been coordinating with county emergency services, environmental health, and social work staff, as well as county and city fire marshals, to connect with and provide guidance to these facilities. In response to outbreaks in facilities in our county, we have scaled up our communications with the facilities, providing them with information on how to connect with providers and laboratories to assist with testing of all residents and staff. It has taken and will continue to take many partners from the private and public sectors to make widespread and regular testing in long-term care facilities a reality. Buncombe County Public Health is working daily to build this capacity in our county. We want to acknowledge the contributions of Range Urgent Care for their efforts that began early on in response to this pandemic to provide COVID-19 testing to the community. They have been an integral partner to us and to long-term care facilities in our county, willing to step up to provide staff and resources to do specimen collection in these facilities. Their actions are important in slowing the spread of COVID-19, and it speaks to their understanding of how devastating COVID-19 can be in these facilities and in our community as a whole. Their actions are a bright spot in the COVID-19 response. As of noon today, there have been 342 lab-confirmed cases of COVID-19 in Buncombe County residents. Approximately 20% of these cases are in individuals of color. Racism is a threat to public health, whether it shows up in the form of inequities in COVID-19 illness and death, complications from diabetes, infant and maternal mortality, or as police brutality, as was tragically witnessed last week in Minnesota. As I mentioned earlier, 29 Buncombe County residents have died from COVID-19, including 24 residents of long-term care facilities. We are seeing an increase in cases in our broader community outside of long-term care facilities. And so I cannot emphasize enough how important it is to continue to work together to slow the spread of COVID-19 in our entire community. Some more practical guidance to curb COVID-19 is to be aware that in closed and crowded settings, especially with prolonged and close contact, have the highest risk of transmission, while casual interaction in outdoor settings seems to be much lower in risk. So when you meet up with individuals outside your immediate household, if you choose to do so, meet up outside. Don't host a large house party. Don't share food or drinks. Wear a face covering and keep your hands clean. And please stay home and away from others if you are sick. The fact is that COVID-19 is a global pandemic that has changed our world. This is our new normal. As we move forward during this time, let's all take practical and important steps to be prepared and to care for each other. Thank you.
Good afternoon. I'm Dr. Bill Hathaway. I am the Chief Medical Officer of Mission Health System and the North Carolina Division of HCA Healthcare, and it's a pleasure to be here again. The first thing that I'd like to do and share with you today is an update from my prior presentation related to the outbreak of COVID-19, the cluster of cases on our pulmonary care unit that we talked about last week. If you recall, we had identified 6 staff members who tested positive in relation to that cluster of cases. We had done an additional 48 tests that were negative, and 7 additional tests were pending at the time we last spoke. I'm pleased to say that at this point in time, all those tests have returned negative, and we have not identified any additional cases related to that unit. I'd also like to comment about what we have seen as a recent increase in the overall number of cases, both in the community, as Dr. Mullendor mentioned to you, and at our hospital recently. Typically in the past, we have had less than 6 patients hospitalized throughout our health system with COVID-19 illness. Over the last 10 to 14 days, that number has increased to a point now where we are seeing on average between 12 and 20 patients per day. About half of these patients tend to be located in our intensive care units, and a smattering of those are on ventilators. While unfortunate and certainly disappointing and tragic for the families and the patients involved, I would not say that this is unexpected at this point in time. Given the increased mobility that we have seen in our community as we open up the economy, we will continue to expect to see additional cases of COVID-19. We have yet to create widespread immunity in our community, and I want to emphasize that. Nothing has changed since the beginning of the epidemic except the passage of time. The processes and the ability for us to be infected by this illness continue at this point in time. We must be careful and cautious. At the same time, I also want to emphasize that we have ample resources to care for the patients at this point in time. We are not overwhelmed with patients. We have the ability to increase our intensive care unit capacity 2 or 3-fold, 2 or 3 times as many as we have now, and we're not at capacity as it stands. And so I want to also emphasize that we have ample protective equipment and ample ventilators on hand to handle the cases as they exist at this point in time. We monitor this daily, watching closely to see if the situation changes. But it's a critical and important reminder that as we see these cases rising in the community, that we're attentive, as Dr. Mullendor so articulately pointed out, to be good stewards for the entire community and wear a mask at all times, wait 6 feet apart from each other, and wash our hands as much as we possibly can when in social settings. And I'd like to emphasize that despite the ability to move around more freely, we should really only do so when it's absolutely necessary. And we should limit the interactions that we have with our fellow men and women as much as we possibly can so as to minimize the spread of this disease.
Good afternoon. My name is Fletch Tove, Public Health Emergency Preparedness Director. Today, as flags across the state fly at half staff, we come together to mourn 29 residents of Buncombe County who lost their battles with COVID-19. It's important to reflect that these 29 deaths are not just numbers on a graph. Rather, each one indicates the loss of a mother, a father, a wife, a husband, a sister, or a brother. It's also important to understand that we are still in the middle of a global pandemic and that there are still a long and arduous challenges ahead of us. This month, the death count in the United States will overtake the 116,000 deaths we suffered in World War I. And it's important to acknowledge that the majority of those losses in World War I were not due to combat, but were due to the influenza pandemic of 1918. I know that most of us are exhausted and fatigued by the last 10 weeks worth of restrictions and mitigation measures. These 10 weeks have felt like a whole year. The disruption to our lives, our businesses, and our families have been significant, and for some of us, devastating. The exhaustion and fatigue are warranted, but we must remain vigilant in the face of this COVID-19 pandemic. As we enter the second week of phase 2, let's take a moment to understand what those restrictions have afforded us and why every one of us has to continue to do our best to limit the transmission of COVID-19. Our orders and restrictions, first and foremost, were able to prevent an initial surge of cases from overwhelming our local healthcare systems. We did a very good job with that. Second, these restrictions and mitigation measures afforded us time to be better prepared to confront this novel and unprecedented public health threat as we start to reopen. In the weeks since our initial stay home, stay safe order, we have established isolation and quarantine facilities and strategies for our community. We have allowed time for our supply chains to adapt so that we can restock our PPE and sanitation products. We've greatly expanded our testing and contact tracing capacity, and we have worked relentlessly in our educational and outreach efforts. We are able to reopen in a controlled manner now because we were so diligent in our early efforts. We have recently seen a jump in our cases and our deaths. This is unfortunate, but it is and will remain an undeniable consequence of our efforts to slowly reopen. Our goal is to do everything we can to minimize new cases and deaths as we continue to reopen the community. And everyone can help with that effort. Everyone can and should practice the 3 W's. Wear a face covering when you're in public. Wait 6 feet away from other people. And wash or sanitize your hands often. Every time you practice one of the 3 W's, you may be potentially blocking a line of transmission, preventing others from getting sick, preventing others from dying. This pandemic has affected all of us in one way or another, and it's the shared responsibility of all of us to continue to work together so that we can get through this together. Thank you.
This has been the 31st Buncombe County Community Update in response to COVID-19. And a lot has changed since the first update. As our community reopens, reliable and timely information will continue to be essential to the safety of everyone in our community. We will provide the next community update on Thursday, June 4th at 2:30 p.m. Thank you for your time and efforts to stay informed.